Hi there, my name's Lauren and welcome to my channel Vet Med Demystified, where I show you what it's really like to be a veterinarian. Today we're going to be talking about how veterinarians are surgeons, so if that interests you, go ahead and keep on watching. Now, I'm sure that you're aware that veterinarians perform surgery, but you might be wondering, what does this look like? What is the process? So come along with me on a Friday shift to see how a veterinarian handles surgical cases. All right, it is 8 a.m. You have entered the hospital and you are heading to your office to check your schedule for the day. Here we are, and we're gonna pull it up on your computer. All right, as you can see here, we've got 3 surgeries for the day, which I'd say is pretty standard. Typically, vets work 4 10-hour shifts a week, with one of those being on the weekend. Surgeries are generally scheduled Monday through Friday, so on the weekdays, but occasionally there's an emergency that comes in on the weekend, so you never know when there might be a procedure then as well. Now moving on, if you look to the left here, these are all the doctor's appointments for the day. And as you notice, there's a big blue gap right there, and that is what's known as the doctor's block-off time. So a doctor's block-off time is when they have no scheduled appointments so that they can perform surgery. This block-off time is generally in the afternoon, and it will be a couple of hours long because doctors normally have multiple procedures that they need to do. And once they are done, they actually use the remaining time as their lunch break. Okay, your first surgical patient, Billy, has arrived, and he is here for a hernia repair. Surgical patients generally arrive first thing in the morning, so before all the other appointments roll in, the doctor is going to want to examine the surgery patient and review their blood work results. As you examine Billy, you just want to make sure that he's physically fit. You're mainly looking for any underlying conditions, such as a heart murmur, that could cause anesthesia complications. Doing this and reviewing his blood work only takes a couple of minutes, but it's crucial to ensuring that surgery runs smoothly. All right, now that we've decided that Billy is fit for surgery, we're going to do some drug calculations for the medications that we're going to use during the procedure. So the doctor is responsible for calculating the information that can be found on this anesthesia sheet, and it includes drugs that are used preoperatively, intraoperatively, and postoperatively. Technicians like myself will draw up the correct amount of the drug and administer it when necessary. A couple hours later, after the doctor has finished their appointments and the technicians have sized Billy for his ET tubes, placed his catheter in, and set up the anesthesia machine, we're ready to start surgery. All right, so we're gonna make sure that Billy's catheter is still all good and everything's going into his veins. And then we're going to administer a drug called propofol, which is gonna render him unconscious so that we can intubate him. Okay, and Billy's feeling pretty sleepy now, so we're just gonna put this tube down his trachea to make sure that he breathes properly throughout the entirety of the procedure. We are hooking him up to the gas to make sure he stays asleep and pain-free during the surgery, and we are also inflating the tube to protect his airway the whole time. He's connected to IV fluids so that he stays hydrated, and he is also hooked up to a monitoring system so that we can watch his vitals. Billy has been flipped over onto his back, and now the technicians clip and clean the surgical area before the veterinarian gets started. We're now draping Billy so that that clean area can become our sterile surgery site. Instruments and blades are passed to the doctor by the technician so that the area of the surgery site does not become contaminated. We make our first incision to help get rid of Billy's hernia. This procedure was very quick and only took around 10 minutes. Neuter procedures generally take around 15 to 20, and spays can take upwards of an hour, generally around 45 minutes to an hour. So the amount of time spent in surgery is definitely going to vary. And just like that, Billy has been relieved of his hernia. Super quick and easy. We suture him right back up, and he's gonna be feeling so much better now. And there you have it. Billy will be woken up by a technician who will make sure that he recovers properly. The vet's job is to talk to Billy's owner and make sure they're aware of his home care instructions and what medications he'll be taking. They'll also need to be efficient and make sure that they have enough time to finish the rest of their surgical procedures during their block off. I hope you found this video helpful and that you were able to see surgery in a new light. Keep in mind that this is only part of what a veterinarian does every day. Besides being surgeons, they are dentists, pharmacists, radiologists, and practice pretty much any type of medicine you can think of. If that sounds interesting to you, check out my channel to explore the other facets of veterinary medicine. Learning more about the profession might help you decide that it's the one for you. Thank you so much for watching. Bye!